It's totally understandable if you have lung disease to think that if your breathing has gotten worse, that that is a result of your lung problems. But sometimes it's not. In fact, I've got a lot of patients this applies to. One at the moment that I'm seeing has a long history of lung disease and breathlessness. But in the last month or so, everything's been deteriorating, and the lung disease, in actual fact, is fairly stable. What we found was that she had excess fluid on her lungs. In fact, she'd had original damage to her lungs from radiation treatment because she'd had a history of breast cancer. So, as you would expect, if the treatment was on that side, the left side in this case, then you would expect that's where the most of the scarring in the lung is. But when we examined her and when we x-rayed her, it looked like she had worse changes on the right. So clearly this isn't consistent with her history. Something had changed, and in fact what had happened is she had developed excess fluid on the lungs. Now there can be many reasons for that too, but in her case I think it came down to a number of parts of her history and her medications. And what we did was we gave her more diuretics, watched her weight, watched that drop, and a dramatic improvement in the baseline function of her breathing and the level at which she needed oxygen to survive. So this is something to be aware of. If you have lung disease, that worsening in your breathing might not always be your lung disease. It may actually be some other contributing factor. So it's always important, if something has changed in your clinical history, then please see your doctor and tell them that and let them have an assessment of what's going on. Because in this instance, it was something that was relatively easy and quick to fix.